Do you ever worry that your knee might pop, tear, or give out during sports? Here's what you can do to protect your knees without giving up the game. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Today, we're talking about something nearly every athlete, weekend warriors, and professional alike worries about: how to prevent knee injuries during sports or high-impact activities. Whether you're running, jumping, pivoting, or squatting, your knees take a lot of pressure. But here's the thing. Most knee injuries aren't from trauma. They're from cumulative stress, instability, and poor preparation. The good news, there are specific steps you can take to lower your risk without fancy equipment or complex routines. Let's break it all down simply. Before we talk about prevention, it's important to understand what causes most knee injuries. From my experience, there are three main causes. Instability, loose or weak supporting ligaments, especially after prior sprains or overuse injuries. Inflammation, often from repetitive stress or underlying medical conditions. Neurologic issues, poor muscle control or lack of coordination between brain and body. If you don't stabilize these three factors, your knees are at higher risk during any athletic movement. Most people either skip the warm-up or rush through it, but a proper warm-up is one of the best ways to prevent injury. Try this dynamic sequence before your activity. Leg swings, front to back and side to side. High knees or light jogging in place. Lunges with torso rotation. Short jumping jacks. This prepares the muscles, improves blood flow, and gets the joints moving. It tells your body, hey, we're about to move with purpose. Strengthening the muscles that support the knee. Strong muscles equals stable knees. You want to focus on your quads with leg extensions, squats, and step-ups. Hamstrings with deadlifts, bridges, hamstring curls. Glutes, hip thrusts, clamshells, lateral band walks. And the calves, heel raises. These muscles absorb shock, protect ligaments, and improve balance. Even just 2 to 3 days per week of targeted strength work can make a huge difference when it comes to protecting your knees. And don't skip mobility and balance training. Flexibility matters. Tight muscles can pull your knee out of alignment. Balance helps your knee respond to sudden shifts or awkward landings. You want to try foam rolling your quads, IT bands, and calves if there is some degree of tightness. Hip flexor and hamstring stretches are key. Single leg balance on a cushion or Bosu ball. Eyes closed balance drills. It's about building control, not just strength. How you treat your body after workouts matters as much as what you do before. Recovery is where your tissues repair and get stronger. Some keys here. Hydrate well. Dehydration affects joint function. Sleep at least 7 to 8 hours a night. This is when your body repairs. Anti-inflammatory foods. Berries, salmon, olive oil are key as well. And supplements like collagen, turmeric, or omega-3s are also important in terms of inflammation, but always ask your doctor first with these. Also, don't ignore early signs of soreness, swelling, or stiffness. Address them early so that they don't become a bigger problem later on. Here's some things you want to avoid, common mistakes that can lead to injury. Here are the big ones that I see in clinic. Skipping rest days. Overtraining breaks you down. Improper shoes. Old or unsupportive footwear can lead to disaster. Ignoring nagging pain. Pain is information. You want to listen to it. If your body is telling you you're having pain in an area, make sure you see a physician to get that evaluated and treated. Overlying on knee braces. Knee braces can give you support. Using them as tools is helpful. You don't want to rely on them as crutches, however. And then jumping into high impact workouts without progression can be careful as well. You want to be patient and you want to build up your capacity over time. So when should you get medically evaluated? I would say if you're having swelling in the joint after activity, pain that lingers for more than a week, that's different than just muscle soreness. This is true pain in the joint. A knee that gives out or feels unstable is a red flag for possible injury to the ligament and definitely needs to be evaluated. Clicking or locking sensations should be evaluated as well. Could be a sign of a meniscus injury. Get it checked out. The earlier we find the root cause, instability, inflammation, or neurologic control, the easier it is to treat with conservative care. What treatments can help if you're already struggling and have tried conservative care? I specialize in non-surgical treatments that work with your body's natural healing system. Some of the options that we offer include the following. Prolotherapy. This utilizes dextrose or sugar water to strengthen the ligaments around the knee. Platelet-rich plasma, or PRP, uses your body's own growth factors to reduce inflammation long-term and improve tissue repair. And then there's bone marrow-derived stem cells, which are for more advanced wear and tear and injuries and can be very helpful as well. Also, focus on nutritional and metabolic health optimization because your joint health is a whole body health issue as well. Your physician should be thinking about that as well. I would recommend avoiding steroid injections. And if you need surgeries, try to avoid them if possible. Definitely maximize your non-surgical options first. But if you do need to get a surgery, try to avoid surgeries that are not repairing issues, that are just trimming up tissue or cutting out tissue. It can lead to more instability long-term. As always, start with your lower risk options first and then build up as required. That's the path to lasting and better healing long-term. Knee injuries do not have to be part of your athletic journey. With the right mindset and strategy, you can stay active, strong, and injury-free for years. Start small, just one better habit at a time, build strength, improve stability, and take care of your knees before they scream for attention. If you found this helpful, please make sure to like and subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. You can also book a consultation with us if you're struggling with knee pain or want a personalized prevention plan. Until next time, stay active, stay smart, and live well.